Hello, it's good to have you on the program again today, and of course, it's a pleasure to be here to share the moments with you. It still remains the economy today on KAFTAN television. Of course, this day we have something to talk about. Oh, okay, it's going to go here, by the way, and I will let you know what we have for today as a topic. Looking at the fact that at a time like this, talking about the rainy season, most of the time a lot happens. And so we decided to bring someone that knows what should be doing, what we should be doing at a time like this in here, talking about medical personnel. And so we'll be looking at economy and health. Then health is wealth. Let's see how much it is, how viable that statement has always been, health is wealth. Well, someone will explain it better as we go on. And so I want to say welcome. And he is someone that's not new to this program, really. He's been here severally, and he'll be here again, even to talk with us on the program as health affects the economy. Talking about Dr. Levin Damisa. We'll have him in, but straight away, let us look at what we have. Talking about the fact that we have the business news. We also have the stock exchange, and before the discussion itself. So let's just go straight and take the business news first of all. Then we'll return to take the stock exchange.
The Central Bank of Nigeria says its economic reforms over the past 34 months are laying the foundation for sustainable growth, financial stability and job creation. Speaking at the CBN fair in Bauchi, the bank's acting director of corporate communications, Hakama Sidi Ali, said the measures are already producing positive results across key sectors. He highlighted reforms including foreign exchange market reforms, banking sector recapitalization, the non-resident bank verification number system, the B-Match Forex platform, and the Nigeria Payments System Vision 2028. Sidi Ali said the policies are designed to strengthen the economy, improve financial inclusion, and support poverty reduction. She added that the CBN remains committed to maintaining monetary and price stability under the leadership of Governor Laimi Cardoso, while noting that recent economic indicators show encouraging signs of progress. The federal government says payment of outstanding 35,000 naira wage award arrears owed to federal civil servants will begin before mid-August. The assurance was given by the Minister of Finance and Coordinating Minister of the Economy, Taiwo Yedele, during a meeting with the Joint Public Service Negotiating Council in Abuja. The government said the required approval for the payment is at the final stage, while outstanding promotion arrears and salary-related allowances are also being processed. The development follows renewed concerns from organized labor over delays in implementing workers' welfare agreements. A statement from the Ministry of Finance said the government remains committed to addressing outstanding obligations to public sector workers. Meta Platform says one of its artificial intelligence models gained unauthorized access to a third-party system during a cybersecurity test, raising fresh concerns about AI safety. The company said the incident involved its Muse Spark 1.1 model after a configuration errors by an independent testing partner accidentally gave the AI internet access. The model then exploited a vulnerability in an external service. Meta clarified that the incident was not an AI system escaping its security control or launching a sophisticated cyber attack, but rather the result of a testing environment mistake. The disclosure comes amid growing security scrutiny of advanced AI systems with other developers, including OpenAI and Anthropic, also reporting unexpected behaviors during security evaluations. The Nigerian Communications Commission has directed telecom operators to set aside dedicated fund for cybersecurity as part of measures to protect the country's digital infrastructure from rising cyber threats. The directive is contained in the Commission's Cyber Resilience Framework for the Nigerian communications sector, which requires operators to strengthen cybersecurity governance, risk management, and incident response system. The NCC says telecom companies must treat cybersecurity as a strategic priority by investing in security technology, staff training, monitoring system, and compliance measures. The framework also mandates operators to report major cyber incidents within 4 hours of discovery. The Commission says the new measures will improve the protection of critical communication networks, supporting banking, digital payments, government services, and Nigeria's wider digital economy.
If we had a better structure, I thought I had some kind of stuff in mind to say geopolitical zones, and we had a plan that every geopolitical zone must have a power station, for example. That means we have a minimum of 6 strong power stations.
Yes.
It's very important that we embrace these investors.
I think what they want to do now is to be able to make them understand that, look, going forward, it's no longer going to be business as usual. Whatever that may be happening in the past, we want to now be able to put a system in place that will checkmate, correct the ills of the past, give us a new pedestal from which to stand and operate going forward.
Officially, what we get in the country, 79% is from crude, foreign exchange, 11% is from oil, from gas, natural gas. Between the two of them is 90%.
If we are getting whatever it is we are getting from oil revenue today, you look at the oil revenue is more than enough to take Nigeria to her next level. But at the end of the day, the processes, the leakages, and so many things that have become like an epidemic on our economy will not allow whatever we are gaining or getting from this deposit or these blessings from God to give us what we are looking for.
The coming of Brazil now this time is important. Then first they have to organize a workshop for these herders, those who rear cows. This is why it's good for you to have your cows in a particular place, and these are things you do to feed them well, and they will equally have good meat for consumption.
The end of a matter is better than its beginning, and in the other way around, the beginning of a thing also can predict.
That's it. Having seen what we had and that one, we just took this break so as to let my guest sit. And so where here he is, and we want to talk. I told you that I have someone, because we are doing things that have to do with health today, economy and health. That is it. So we decided to get someone that can help us get it done, because it's not what anybody can talk anyhow. And so looking at that topic again, economy and health, then we'll look at the fact that we're saying health is wealth. Sir, I want to say welcome to you in the first place, and I said I had earlier introduced you. I'm talking about Dr. Devin Damisa, of course, public health physician. Right. You're welcome. Now let's talk about it. So, you know, sometimes when people hear, like on a program like this, we say economy and health, they say, what has health got to do with the economy? But I know it has a lot to do with the economy. Please just help us talk a bit of what health has to do with the economy.
Okay. Well,
before we now go to the main one, I said health is wealth. So let's get it.
Yeah, the health and economy are actually, let's say, two sides of the same coin.
Okay.
In this context. You need a productive people. You need people who are healthy to be productive, either mentally productive or physically productive.
Yes.
Let's even use what people can relate with. physical fitness. If a man is not physically fit, the amount of work he can do is limited. Despite, of course, we're in the post-COVID era where people can work from home, remote working is now the order of the day in some countries. But even at that, you have to be healthy to still be able to work remotely.
Even from remote bases, yes.
So to that extent, you can see that health and economy go hand in hand. Now bringing it to physical planes where we are here, if a nation is full of sick people, you see that the amount of resources that you channel into treatment means there will be a shortfall in other critical sectors of the economy. If, for example, if 80% of your income, let's narrow it down to a family. If 80% of your income go to treatment of sickness, let's say cancer, how much do you now have to train your children, to build a house, or to even invest? So you see that health and economy go hand in hand.
Even to eat. How much do you have to eat?
To eat. So that's why you find out that health crisis is one of the fastest routes to poverty.
Poverty, yes.
Health crisis. That's why nations who know this, they build system, retirement system, plan, so that, because a time will come that everybody, no matter how good, how intelligent you are, for example, some of our professors who taught us in their prime, they are old now. They can't even handle scissors. They can't handle scalpel. They can't even handle chalk, of course, marker these days, because the physical strength is just not there. Despite the shelves filled with books, despite being quoted in researches, because every man eventually declines physically. So health crisis can hasten that decline. Imagine a professor of 50, a professor at 55, who suddenly develops stroke, who suddenly develops cancer. You find out that if there's no system is put in place to care for him at that phase of his life, if his earnings is tied to going to classes to deliver lecture and do research, it means that pipe is vandalized, is blocked. And when there's a blockage, it means that if he doesn't have resources he has invested before, he has nothing to fall back on. That's why a lot of retirees die very quickly, because there is no system
to fall back on. Okay.
So to that extent, you see that health and the economy go hand in hand. Now look at it the other way around. If the economy is good, people can invest in health, people can take care of themselves, people will not need to do 5 jobs, because when the economy is good, you find out that you don't need to do 5-10 jobs to survive. It means you have a reserve, your body rests well, your body recuperates better, you are able to plan more strategically to engage in other areas of the economy. You can diversify. Nothing wrong with a man having a school, having a factory, having a that, having a this, but that is when things are working. So you don't need to exert yourself. You need to see some of our friends out there who have to do 3-4 jobs to make minimum B. At the end of the day, they get so drained, so fagged out. You see fatigue every day, mental fatigue. And with mental fatigue, you are prone to errors. So you can see that a healthy nation will be a very economically sound country. If a country is full of sick people, resources, it means productivity, the GDP will be affected, because people who are sick don't produce economically, optimally anyway. So these are a few areas that we can look at. Health and economy go hand in hand.
Thank you so much, sir. It's a very big, great expose you have done for us to understand it, because sometimes, honestly, people don't get to see it. But I know that whoever that has watched or that is watching, by the way, of course, this program is streamed live on the social media network, so definitely there are people, not just people here, but all over the world watching, and it means a whole lot, because I remember growing up, there was this great fellow that had strength, had energy, and had zeal to do work. At a stage, there was health challenge, and the man became a different thing altogether.
Yeah.
And thanks to God that eventually medical assistance came early enough before death could strike, and he was restored.
Okay.
And so looking at him, though he had, grown so lean, there has been so many pains and stresses that had gone on, and at the end of the day, he was able to start gradually to get back to what he used to do. And each time I look at him, I say, oh, it's good to be healthy.
Yeah.
Is that, in that period of sickness, he would have gone through a whole lot of loss, financially speaking, because he had a lot, but at that point in time, almost lost everything before he got restored. Now, look at this thing that we say, health is wealth. Is that kind of thing, or is there any other thing that we need to talk about that will tell us about health being wealth?
Okay, health being wealth, because it's a maxim that people say commonly, but many a time, people don't actually know the gravity of that statement, that health is wealth. I give you an instance. When we were in medical school many years ago, and, a professor came into the clinic, and I think it was in neurology clinic. I can't remember the clinic exactly, but I know one of the major things he presented with is inability to write. He became dyslexic. He couldn't write. Imagine a professor. The part of your body is your career is linked to your part of your body.
Yes.
For example, if somebody is going to be a driver, the hands
and legs must be okay, and the eyes, yes.
So every part of you should be very okay, but your eyes and your hands,
exceptional
just like
areas.
tennis players. For tennis players, they insure their hand more than they insure their legs. Football players insure their legs more than their hands. So even though the whole body is being insured. So what am I saying is that,
and if you were to be abroad now, for people like us, we insure our voices. Very effective.
Very effective, voices, because you have to insure.
Yes.
So the point is that when a professor cannot write, it means that his ability, then before the digital era, it means his ability to access PhD thesis, his ability to access masters, his ability to evaluate papers for journals, review will be limited. So if his earning is tied to that, it means that once he becomes dyslexic, unable to write, of course, it goes also with other cognitive decline.
Yes.
It means his usefulness, in quote, has reduced. So also his productivity. So health is what means that you have to be healthy to pursue wealth. You have to be healthy, mentally healthy, physically healthy, and I also want to add spiritually healthy for you to pursue wealth. That's why they tell you that you must take care of the body, because how far you will go depends on how you take care of your body. Have you not seen people that work all their life, no time to rest, and then when it's time to rest, sickness strike, and then every saving they've accrued over the years is used to service that sickness. So when we say health is wealth, we are telling you that your health is your most prized possession, because every order of your earnings, every order of your capacity, every order of your ability to be productive economically is tied to your health.
Okay.
For instance, you're a researcher and you're careless with your lifestyle. You go into a lot of alcohol, your liver is destroyed. When they need you, because there are some meetings that you need to present yourself physically. There are some fora that you must present your findings. People want to interact with you.
Yes.
You may say, well, it can be done virtually. Not every engagement is done virtually.
Yes.
So if you cannot attend such a platform, what happened to your findings? So that is why a man have to, when I mean a man, I mean generic man, a human being. A man has to take care of his health, because health indeed is wealth. If you are sick, what gain do you have? You have all the money in the bank, but you can't see. Imagine having the best wardrobe of clothes and you are blind. Of what you use is having plenty shoes when you cannot even see the color of the shoe. So health indeed is wealth. It just means that people should place premium on their health.
Okay.
Whatever you can do to do exercise, to be physically fit, you should do it. And of course, fitness science will tell you that as you grow, as your body age, some other exercises need to be done. You just have to exercise your muscles, your brain muscles, your physical muscles, all need to be taken care of, so that after making the whole money,
you'll be able to stay back to eat,
to enjoy the proverbial fruit of labor.
Yes, yes. Okay, thank you. Now let's look at this way. Nigeria, looking at the population, and you see the way our people are. Let me talk about the fact that every day, when people go to work and come back home, but you get to, as you move along the road, you get to bus stops or bus terminals, as the case may be. You see many people there, and they are all struggling to get into vehicles that will take them, whether public transport or private that will come to assist and all that. And they struggle. After all that, they get to the office. While going back, it's the same process. Is this good for the health of Nigerians?
Oh, you're talking, I'm having Lagos in mind.
Yes.
You know, the life in urban cities. This scenario you just painted, it's actually a system thing. When I mean system, a lot of factors come into play. The urban-rural drift population.
Yes.
When I was privileged to study in India some years ago, and I see some of Nigerians in India at that time, I told myself, I said, some of these people have no business being here, because they were not in the ICT firm, they were not doing, they were just struggling. And I feel you could have done better back home than after school, you stay back, you're just a liability on the system. India will not give you citizenship, because India doesn't give you citizenship, whether you are born there or not. I mean, as a foreigner, you're not an Indian, you're not Indian, because they have their own system, the caste system and other things. So you can't just come and say, I'm not an Indian. So even some of them abroad have to renounce to pick up other countries. So I told myself, some of these people have no business being there. The same way, there are people who have no business being in Abuja or in Lagos. They are better off in their places. But you see, when there's a push, or what we call push factors, when there are push factors, people come to the urban area. There's population surge. And so what you see is actually a result of a lot of things that are not in place systemically. For example, the man who you see at the bus stop running, trying to get vehicle, he has no light in his village. So he come to the town to see if he can use light. The power sector. So you find at the end of the day, people you see struggling, they are trying to, they are living far because they cannot afford accommodation in the city center. So they live far away. So they have to leave house early to come to work in the city. And then when they close, they have to rush back because of the distance involved.
Yes.
So either way, there's a cost of time, there's a cost of resources, time is still a resource, and there's a cost on their body, on their health. That's why they go home. Many of them eventually end up with pain relievers every day, because each day is stress, each day is work. So all these generally affect the health of people. Don't forget that, again, you wake up earlier than you ought to wake up, because you have to travel for 2 hours before you get to your place of work.
Distance,
so imagine spending 4 hours every day on the road, 2 hours to, 2 hours fro. That's even easier. In Lagos, in some places, it's more than that. You wake up 7, you wake up 4, get to work 7, 3 hours. You come back home, you get home 10 o'clock or 11 o'clock. You sleep by 4. So at the end of the day, you end up having less than 5 hours of quality sleep in a day. And when that continues consistently over a period of time, it starts affecting your health, because your body has now shifted from the normal day-night rhythm of the body to something else. So these are some of the challenges that you see people go through. When you sleep less, you rest less, your resting hour is reduced, your sleeping hour is reduced because you need to get to your place of work. All these have effect on your health.
Good. All these have effect on the body, on the health. The same way, would you say that they all have effect on the pocket.
Of course, yes. Because if you're not sleeping well, you cannot think well. So your ability to be productive is compromised. Of course, let's even go the physical way. If you are stressed or you need to take pain reliever,
You're buying it.
You're buying it. That's why the government on its own, let's give to the government, the government is trying to popularize health insurance. Universal health coverage.
Okay.
So that what you are earning should not define whether you have access to quality care or not. I think the government needs to be commended for that.
Okay.
The Ministry of Health is pushing it, the NHIA is pushing it, so that even those in the private sector can also have access to health care. The reason is that out of pocket, what we call in health economics, what we call out of pocket expenditure can be is quite high in emerging economies.
Yes.
Because, like I said, when
this happens, it becomes minimal.
One health scare can cripple your finances.
Exactly.
So when a man says, I have money in the bank, you don't know. Just pray against health scare. Because one health crisis, imagine having to do a test that will cost you 1 million. Having to do tests that will cost you 2 million. How much is your savings in a year?
I wonder.
So all these things affect your pockets. So eventually, health indeed is worth. Meaning that whatever you can do to protect your health, as a man, you must do it. And it's something I teach in any platform I get to, that you cannot outsource your health. You cannot give your health to somebody else
to take care of.
You can't say, go and sleep on my behalf. Go and eat on my behalf. Go and have your bath on my behalf. No. If you need to sleep, you have to sleep. If you need to eat, you have to eat. If you need to make a call, you have to make that call. Nobody, there are things people cannot do for you. That is why no matter how busy a man is, even when you have 5 or 10 aides who answer your phone call, there is that phone call that they will bring to you to say, sir, this is for you, sir. Are you getting me now? Yes, this is for you, sir. Because you cannot outsource some responsibilities. So also when it comes to your health, you cannot outsource it. You must take responsibility. And that is why decision making is involved in where you stay, where you live, where you work. Some people have had cause to change their place of work because of where they are working is far from hospital and they have younger children. So they would not take a less paying job that made them stay closer home and close to hospital until their children are grown. Those are planning.
Yes.
You can't be working, okay, your hospital is 20 kilometers away, your office is 40 kilometers away, and then what happens in emergency? How do you care for your children? That is how the West plan. In fact, in Western countries, you can't just choose school anywhere. Your school should be close to where you stay. So in case of any emergency, your time to reach school to pick your child is already defined. Everybody know that in fact, in some state America, you choose school by county. You can't be living in, for example, you can't be living in Guarimpa, and your school is in Lokogoma. They will tell you no, your school must be here. So that in case of emergency, traffic diversion is already planned. You know, everything affects everything.
Yes.
As my wife would say.
Yes.
So you find out that is why planning, town planning is not a little. People think that town planning is just one of those lazy feet. No, town planning is not a little feat. It's a system. Town planning requires system thinking.
Okay.
How far will the hospitals be from school? How close will the school be? What is the population envisaged in this area? All those demographic issues have to be considered because they all eventually have impact on the health of the people, if not now, on the long run.
Yes. Again, looking at these push factors you talked about before, you see, people leave their villages, their hometowns, whatever you call it, and they will go to the cities, to look for money to see how much they can make to be able to take care of themselves. Those factors, if there were to be good schools, good hospitals, good roads, good things after electricity, just as you mentioned that one, and if there were to be these everywhere, it will be easier for people, that is, if these things were to be made available to people in their localities, it will be easier for people to stay where they are and continue their lives. But the problem now is that I wouldn't say entirely that it is planlessness on the part of the government, but sometimes it is implementation, lack of implementation of some of these lofty ideas and beautiful goals that government gets to have. But we find out that we don't see such things. And so there are 3 tiers of government. We have the executive. I'm not talking about the executive. These are arms of government now. Talking about the executive, the judiciary, and the legislature. No, I'm talking about arms. I'm talking about tiers now. The state, the federal, the state, and local governments. You are a health practitioner. Looking at health provision facilities in local areas, because I know that if we have these things, I know of some communities where there are no hospitals at all, and there are very few, maybe some of them will have one health center for the entire community, and if you get to that health center, it's only just 2 nurses that are placed there, just to take care of women that want to give birth to children, maternity, kind of, that they have. If these things are provided, would it have any strain on the economy of the nation, state, or local government? That's number one. If it is not provided, the people suffer more. So the strain on the economy has increased, and as a result, they must leave to go to where they will find such things. What is the solution? What can we find as a central ground where these can meet comfortably?
All right. This is quite dicey and technical, so I'll be careful what I say.
Yes, sir.
The issue is that I was born in a maternity in my village over 50 years ago.
Okay.
That means that over 50 years ago, a maternity existed. As I was growing up, they used to show me, my mom used to show me, that's where you were born.
Okay.
I don't need the building is still standing now.
Okay.
But that was, so now. Interestingly, health is one of the items that we call concurrent lists.
Yes.
So the federal government, the state government, local government. The problem we have over the years is over-reliance on the federal government. The woman in the village is calling Mr. President's name for not having maternity in a community.
Yes.
It shouldn't be so. You have a local government chairman who should take care of the primary health care, the health posts, the comprehensive health centers, based on the level of strength and population itself. The person in local government headquarters is calling Mr. President's name that there's no light in the hospital. That is not Mr. President's responsibility. There is a state governor that should provide specialist hospital that takes care of secondary cases. So the problem we have over the years in this country is over-reliance on the center without taking those who ought to take care of us at the grassroots root. We don't hold them accountable. Are you getting me now?
Yes, sir.
Mr. President or federal government, they don't have any business, in quote, with employing professional bed attendant in village. No, there's somebody who is being paid. There's somebody who campaigned. There's somebody who won election to do that for you. So it means that there's something what we call all of society approach. It means that the woman in the village, the man in the village has a role to play. Because if the local government chairman has also provided, again, before we move to solution, we've had cases of people vandalizing what government has provided.
So we have, in actual fact, let me even stress this as you're mentioning it. Do you know that these street lights, these beautiful street lights we have seen here in Abuja, I've had a guest who has been here severally on the program, and he has told me clearly, I said it openly here, that there are young men that climb those electric poles in the middle of the night, get up there, remove the bulbs, open it up, remove the bulbs, and come down. So afterwards, they go and sell those bulbs.
So who do you blame?
So, and we look at all these. These are part of the vandalization you're talking about.
Who do you blame?
I wonder.
There's a story of I don't know where it happened, but I saw it on social media, of a man who entered a building, uncompleted building, stole the paints.
Yes, a young man.
He stole the paint, pour out
Pour
the
the way
paint
the
and
liquid
sold
took-
the bucket for 1,000 naira each.
And that was his own priority.
He got 67,000 naira. That means he threw away, he emptied the content of 67
tins of
paint.
Yes,
So
big
now,
buckets of paint.
do you
Yes.
still bring down Mr. President?
No, that shouldn't.
And so you find that people have different priorities. So to him,
Oh.
that 1,000 naira per paint is his own.
But-
The
but-
content they paint is not his business. So you find out that people need to hold ourselves responsible. For example, if Mr. President or the minister provides electric light, street light, who should guide them?
The people within the area.
So that's how we say community ownership.
Yes.
That is why in project implementation or health programs, we emphasize community ownership. So that if the 10-bed hospital has been commissioned, the community should make sure that those beds are not stolen, that the mattresses are not found in people's houses, and that the WC in the toilet is not broken and stolen by the people in the community. It means that if, as of 50 years ago, in my village there is a maternity, 40 years ago it should have improved to something else.
Yes.
10 years ago, so if every government had layer emphasized
Of one form of improvement or the other.
So you find that those push factors will naturally go down. Why would you be going to National Hospital, for example, to go and do appendix surgery when you have General Hospital that can handle it?
That handle it, yes.
So that's what we're saying, that if people understand the role of government, and we also have a role to play to maintain what we have, the city will not be loaded with people,
Okay.
will not be loaded with population. It means that everybody has a role to play. But you cannot fold your hands. Somebody is destroying what government has installed, and you say it's not your business. It is your business. That's how it runs.
Yes.
It's all of society. So that's how we begin to educate our people. I know this is a TV, so
Yes.
we're in the media.
Yeah.
You know, we need to begin to educate people that I've not seen people that commission a borehole. The next day, people come and say the borehole was not located in one community. Other people come and destroy the
borehole.
You know, so
You have lost, and that community has lost.
It's so I do see blame government because the fact is that if you allow that borehole to stay, the next person doing borehole will not
come there again.
Will come to your own side.
your own.
So that is how I found out that most of our problems are not far-fetched. We're the one doing ourselves, as we say. So for health issues, bringing it to health, it means that the local government people need to do their work, the state government need to do their work, the federal government to do their work, so that the macroeconomic policies, importation, export, importing health equipment, VAT-free, those are federal government duties to make it conducive for the people. So that when you now have a dispensary in the village, let me tell you something. When I work in one state in this country,
Yes.
in my early days, I have a staff who they come to work 3-4 times in a month. So the government has employed you. The government will still force you to come to work.
No.
The person come to work when they pay salary. After 3-4 days, he's back to town, leaving his own work undone. So who do you blame? So you find that there are a lot of indisciplines by people. So it's a whole gamut of issues. That's why when people are talking, government is not doing this. No, you are doing what you ought to do. You didn't come to work as a storekeeper. So when we need something in the store for emergency, the store is locked. Have you not seen cases happen that there's fire outbreak and the person that has the key to the ambulance or to the fire engine
is not there.
Is in town. He's gone for obituary. So these are the issues. These are social issues.
Yes.
So there are things we must begin to educate people to know that every effort you make to promote what government has given your community is for your own benefit, and that will attract more to your community.
Thank you so much, Doctor. I want to ask you this other one. This may be the last question I have for you today. And that is provision of health, that is not health, but drugs, medicines,
Yeah.
really, because most of them, when they talk about drugs, I remember Britain. If you go and say drug in Britain, they will look at you again.
Yes, they look at you. So say
But our
medication.
people here, yes,
Yeah.
people here,
Have you
they
taken your
just keep
drug?
saying,
You
have you
shout
taken
it.
your drug? And
I have
say,
the drugs in the car. You just say, wow, drug in
you
the
should
car.
be arrested.
Yeah, it happened to a Nigerian girl in UK.
Yeah.
She didn't know. She was saying drug, drug. Eventually, police followed her. She slept in the police
Can you imagine?
station.
For one,
And then they
shouldn't
check
have
and
done.
check and check. No drug. And I say, but. And I say, no, it's just medication. They say,
Yes.
language economy.
Exactly. You know. So looking at it now, for people to get medication in Nigeria, the cost of getting medication in Nigeria has multiplied itself over and over again.
Yeah.
How is it? You see some of them because you're a medical practitioner. You see some of them and they come. And people find it difficult. You've treated them, but there is no money to pay for the medicine. What do you do?
Well, it's tough.
And what can we do to stop all these things?
Sometimes you let it go, but how sustainable will it be to let people go without drug? So we have seen cases of doctors paying for drug for people. We've seen pharmacies giving drug out free because out of pity. But is that sustainable? Not sustainable.
What can happen to the economy to make it better?
Yeah, I think let's give it. The government is trying now to actually encourage local production, because local production will generally reduce the cost. Because when you import all the drugs into the country, you use foreign exchange. Foreign exchange put pressure on the naira. Naira go up, demand go up, because people need to import a lot of things. But if we are making it locally, if we are producing our drug locally, of course, I don't want to endorse any product. But
yes,
I know that. I mean, one of our distinguished fathers, Mr. Julius, pharmacist Julius. I think he has Julie. We all grew up knowing Julie. I mean, I think he's based in Lagos also, doing a very good work. So I think Emzo
and these others.
So imagine, even when we're in medical school, there's a drip. It's a drip from Dana. I think Dana is in Niger State or Mina. So imagine those companies being encouraged to produce more. It means that the infusion from those places will be cheaper than the one you import. So it means the impact on the individual pocket will also reduce. So we must do everything to support local production.
Local production of, let me expand it a bit, local production of medicines, local production of vehicles that we drive, local production of clothes that we wear, local production of all these things.
You see, economy grow on a lot of factors.
Yes.
Do you know how, it may sound ridiculous, but do you know how much money we take outside the country to buy school uniform for our children because of want to look funky? Imagine if our children are wearing local fabric. Do you know how many factories, how many textile industries in
that would have
come back to life?
Working, yes.
Do you know how many textiles industries in Kaduna, in Kano, will come back to life if our uniform is not foreign oriented? Looking at the weather, looking at our climate. Do you know how many people you put on the job?
Yeah, and how many of them that will have the ability to put food on the table in their homes?
And when you eat good food, your need for drug may be reduced.
Yes.
So everything affects everything. Before I conclude, when I was in India for some time, you know the way the Indian environment then, I mean, I don't know now. You can buy something foreign, but no problem. It's more expensive. They'll say this is Indian made, it's cheaper, it has warranty. This is foreign made, it's more expensive, no warranty. So what do you choose? You choose the one that
yes.
Interestingly, I remember those days when I buy electric bulb, the person will bring it out of the packet and put a date on it. For 1 year, that bulb has warranty. If that bulb got blown, I'll take it back to him.
He will replace it.
Already he has signed on it. I say, wow. But here you buy bulb in 2 weeks, it's gone. 2 weeks is gone.
Less than
2 weeks is gone. At the end of the day, we are wasting money doing one thing over and over again. So, we're not discussing bulb here. I'm just telling you how nations stimulate the economy. So, if we stimulate local production and local consumption, economy will grow. So, the price of medicines will naturally fall. I think this government is actually pursuing local drug manufacturing. They're also producing local consumption. They are pursuing it. They are pursuing universal health coverage for everybody. All these, taken on the grand scheme of things, will impact positively on the pocket of people. There are pilot programs, but I know of pilot programs, pilot schemes, but you know, if it has not gone around, nobody wants to talk about it.
Very few know about it.
They tell you, no, I'm just praising government. No, but the thing is that if something good is taking place, let's commend it and let's hope for more.
Encourage the government to do more.
Because if you do one, I do one, all the 36 governors do one, that's 36.
Yes.
So at the end of the day, everybody gets better for it. So I pity people when they come to hospital and they cannot buy drugs. There are some of my patients, sometimes you need to change the brand of drug for them.
Because of the affordability.
Because one of the principles of prescription is it must be affordable. What's the point of buying drug prescribing drug that you can afford, or you can afford once, and after then you can't restock. So these are the areas. So health and economy go hand in hand, and like I tell, a family can be plunged into poverty with one health scare.
Yes.
Health scare, one health crisis, knock everybody off. Have you not seen people that will sell house, sell everything just to send somebody to India or Egypt or Dubai for treatment?
Yes.
The person still die. By the time the person dies, the house is gone, the land is gone. So it means the investment they save for the future, they are all gone with one sickness.
Yes.
That is why people are being told to encourage or to embrace health insurance scheme. Embrace them, so that because no one person can survive health scare without the system supporting, because health and economy go hand in hand.
Together. Yes, they go hand in hand. Okay, thank you so much.
Thank you very much,
Dr. Levin. Thank you so much, Dr. Damisa. Thank you for being here and helping us to understand more of this, because most of the time people talk about this and others will look at them as though what you're saying is not in order. So I said, let's discuss it today.
Thank you. Thank you for bringing me. I appreciate it.
Thank you so much. And I want to read something. I want to take something, and after before we sign you off. After that, I will come back to you. And what would you do when I come back to you? Give us, as you gave us tips the last time you came, tips on healthy living, so that the things that will help us stay away from hospitals. You know, you're a doctor. We need to go there, but then things that we need to do so as to help us not to go there on a constant note. Please, we need those things. Yeah. So right away, please, let's take a look at what we have from the stock exchange. Then we'll return and conclude the program for today. And looking at that, we'll begin with the fact that we have the all share index. And talking about that, as that one is there, I need to say that we had effective trading at the NGX. And the market performance, the NGX all share index is what got to 245,209.34 points. And going to get to have a 0.12% increase. That's on the positive. That's plus 297.10 points. Then for market capitalization, we had 158.3 trillion naira for market capitalization. 158.3 trillion naira. That's when converted to dollars, it becomes $116 billion. That's what we had. Then, of course, we also have the value traded. As you've seen, 20.45 billion, 20.45 billion. And the year today, the volume is 531.7 million. That's the volume that has happened there. 531.7 million shares in 44,755 deals. But for the volume, it's 531.7 thousand. That 531 is not just thousand. It's a million, and then 746,000 and 649 shares. That's why you can see there the volume is 53.7 million. So we'll now look at the fact that all these the volume down 35%, turnover down 19%, deals down 7%, and the market breadth was something else. Let's just go on to look at there were 24 gainers and there were 35 losers. So we'll now look at the top gainers out of it. Out of the 24 gainers, we have these 4 that you can look at now and understand the ones that are the leading gainers. We have, as I said, there were 34 gainers and then 35 losers. So we have Etana. Etana gained 10% to 36 naira 30 kobo, while Ava Capital gained 9.63%, as well as Legend Internet that got 9.52%. FCMB Group also came up, and the FCM Group got 8.55%. And now for those who lost, because there would always be gainers and losers on a daily basis, but there were 35 losers, and among the top losers, we have Fortis Global. We have Fortis Global Insurance among the top losers, and Fortis Global Insurance lost 10% to 2 naira 52 kobo. 2 naira 52 kobo. And that's a 10% loss. EcoBank Transnational also had 9.99% loss. Chalarams had 9.85% loss, and Thomas Wyatt also had 9.83% loss. And for those who are the leaders of the market, there are the volume leaders, always will have them in stock. There was FCMB Group that brought in 132 million shares. There was also the First Holdco that brought in 43.4 million shares, as well as Ava Capital brought in 36.3 million shares. Champs brought in 36.3 million shares. All these came in, and these were the shares that were traded on at the stock exchange. And we must say that there are notable stocks like Zenith Bank that closed at 124 naira at 0.81%. Talking about the fact that when you talk about bringing it down, so at 1 naira each, that is gaining 1 naira each. Then MTN Nigeria also closed at 845 naira. It was flat on that day, really. So these are some of them. And if we were to look at the indices from sectors, so the banking indices had 0.62%. That's making 2.69% additional. That is for the last we did 1 week. And we also had others that also made the top 30 index. We had 0.11%, and premium index and consumer goods was at 0.15%. Yeah, that's the top active traders that I just mentioned. And we have the FCMB Group, the First Holdco, Ava Capital, as well as Champs. These were the ones that traded effectively. 132 million shares, 43.4 million shares, 36.3 million shares, 36.3 million shares again. And so the summary is that the market recovered slightly, and with a 0.12% increase or gain, led by banking and financial stocks. Despite the uptick, activity slowed and breadth was negative, with more losers than gainers, more losers than gainers in the market. And year-to-date strength it is still strong. The year-to-date is still strong because it's at 57.58%. Well, that's what we'll just take and let it be at that. Let me return to Dr. Damisa so that we'll conclude. We just have 1 minute to go. So in that 1 minute, Doc, what would you say? What would you give us as tips that can help us get better?
Well, I keep saying, I keep emphasizing the acronym for DREAM. Your diet should be healthy. It mustn't be expensive to be healthy. Good rest, good positive relationship. And then people should learn to move around, exercise. You know, exercise has a lot of benefits. Me, one day we'll talk about benefit of exercise. I will look at different type of exercise and how they affect the body. But we found that exercise can affect the body, it can reduce diabetes, the chance of having diabetes. Exercise is there. Then people will learn to manage stress. Like I said, and I was to be here last week. I couldn't because I have to manage my stress. I have so
Okay.
much on my table,
Okay.
and there's no point coming. The point is that you must take on what is important
Yes,
part time.
what you can
prioritize. Because if you break down, health is wealth. If I
Yes.
break down, I can't be here this week.
Yes.
So sometimes we must learn to say no. And I can
Yes.
say, lastly, because of the time, that saying no in a healthy way is a big key to living healthy
Okay.
in all dimension. No to excessive sleep, no to junk, no to being able to say no when it's very important, when it's very strategic, is a key to a lot of issues that bring benefit, health inclusive.
Thank you so much, Dr. Damisa, public health physician, for being here. Each time, I will always bring you, sir. We don't ask you to come because we look at it. It's some people will say it's the economic program, but then there are economic matters involved in health.
You see, health security is one of the pillars of national health security.
That's it.
National security.
Yes.
Because if a country is not healthy, that population is vulnerable.
Exactly.
Look at COVID-19, as if there's any doubt at all, COVID-19 has now make it clear that health and economy go hand in hand.
Thank you so much, sir.
Yeah, thank
and that's how we'll round it up for you of the program today. Thanking Elizabeth Ahiaba, Sam Omaji, Peace Godwin, Adebayo Sanusi, Joseph Ochediku, Victor Chizea, Oluwaseun Adejuwon, and not forgetting Felix Akinjagula, as well as Victor Adeyeye, and my own staff talking about Faith Gowan. Thank you so much, everyone, for assisting one way or the other. This is Okechukwu Anubuago. May the very best happen to us all the time.